government and the ministry has been doing an excellent job of assessing the situation and making the decisions that need to be made. All of these decisions are very, very difficult ones to make and have to be done in the context of assessing both the benefits of these decisions as well as the risks. There's so many unknowns in this situation. I would say one of the things that we should be focusing on all the time, and particularly once this situation has resolved, is continued strengthening of the entire system so that we would be prepared for not only a recurrence of this condition, but any other stress on the healthcare system. Understanding the limitations and the global nature of this situation, certainly assistance to Armenia with regards to sending of protective equipment, of equipment that is needed in the ICU care or hospital care of these patients, such as ventilators, potentially procurement of some medications would of course be very helpful, but again, very limited. We have been working on the medical side or the healthcare or clinical side to actually have a series of webinars so that we can exchange information, knowledge, talk to each other and discuss difficult cases with our colleagues in Armenia. And these are really bi-directional exchanges. We are all learning about this situation as we go, and we can and have been in fact learning even from our Armenia colleagues about how they have been managing this situation. We are starting to see some of the issues with the supply chains or with the availability, particularly of personal protective equipment. However, the situation is not here in Los Angeles as dire, though again, we are bracing ourselves for that inevitable development. I can tell you that over the past couple of weeks, every single day that I walk into the hospital, the situation is very different, and the practices and the policies have been very different. Again, speaking to and outlining the importance of understanding that the situation is so dynamic, changing literally by the minutes. And so gradually we are seeing changes in the policies of what type of equipment, what type of masks we should be wearing when we are seeing the patients. Some hospitals have started to check the temperature of everybody that walks into the hospital. And that was something, for example, at one of the hospitals I work at, just started yesterday. We are starting to see several of our colleagues get exposed to and actually have and come down with the coronavirus itself. And that's been, the severity of that is variable, just like it is in any other person. We are trying our best to keep up with the literature and protect ourselves and our colleagues as best as we can. But the virus does not know how to separate itself from, or separate people from healthcare providers and not. And so we are very much affected by this as well. Time will tell which country or which region and which experience was the most successful. We still don't know how things are going to end up. For example, in South Korea, there was literature or there was news that there is now a resurgence. And so at the end of the day, which one of these measures will matter and how much very much remains to be determined. I would still say that preparedness and having an overall healthy system, a system that's prepared to deal with this type of shock as well as any other shock, is the best way to go. And sort of the public health or the medical way of saying this is health system strengthening. We really have to focus ourselves on having a robust, strong, high quality, efficient system so that we would be able to handle this and any other future stress. Because let's not forget that the next time we're going to be talking about this, it is likely not going to be because of a pandemic or a virus. It could very well be from a natural disaster or a man-made disaster. And so we need to be focusing on developing a system that is able to tolerate or handle many of these types of stresses.